Welcome to Speak Up and Stay Alive Radio with author, speaker, and your host, Pat Rouleau.
Serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit.
The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau, and this is the best time of the week, the time we have together to rethink patient safety. And I'm so happy that you care enough about yourself and others to listen to what I have to say. I appreciate that, and I appreciate you. Today, I'm focusing on empathy. No, not sympathy, but empathy. When you understand and feel another's feelings for yourself, you have empathy. For example, if hearing a sad news story makes you feel almost as if the story concerns you personally, well, then you have the ability to empathize. When you sympathize with someone, you have compassion for that person, but you don't necessarily feel his or her feelings. Empathy and sympathy are not just two different approaches to dealing with the emotional challenges of others, but they're also quite opposite in many ways. Sympathy places another person's problems at a distance from us. It places us in a position kind of like superiority, and it keeps us separate from each other. Empathy, on the other hand, requires that one internalize the feelings of another. And it's that shared experience that promotes interpersonal connections with others, and this even applies to pets. I think it's fairly safe to say that many people either have no idea how to empathize with another or just simply don't care to. Maybe because it hurts. It hurts to feel someone else's pain or grief or anger, so why would you do that to yourself? Well, maybe to really experience life, or maybe to help that other person as if you were helping yourself. And shouldn't that be what healthcare is all about? I think so. So today, I'm going to share a story about a physician with no apparent empathy, a guest who created empathy training just for healthcare providers, and later in the show, I'm going to play an interview I had with a young man who experienced the school shootings in Chardon, Ohio, and share his take on empathy and his perspective on how to take a negative event and find the positive, and therefore helping others to recover. So, with that to look forward to, let's head into the healthcare hazard of the week. A few weeks ago, my mom was having some interesting symptoms that obviously needed medical attention. I called her cardiologist, her heart doctor, shared the symptoms with the nurse, and she said, "Okay, we can see her in a month." "In a month? Are you kidding?" "No," she replied, "the doctor's booked." Well, now I can understand that, but the need to see your cardiologist, stat, is not something that can wait a month. A heart problem is not like a bruise or a rash or a headache that can wait. "Hang on, Mom, can you ignore those symptoms for another 30 days? Her response, "Go see your primary care physician. He's your quarterback." Ugh, I really get tired of doctors urging me to see the primary care physician because the outcome is always the same. He refers to a specialist. So we constantly waste time and money visiting a doctor who has no solution other than to move us up the chain to a place where I know we should be to begin with. So now we have to get an appointment to see a doctor who will refer us to the cardiologist. Does that even make sense? So Mom made the appointment with Dr. Primary. Mom has used this same practice, the same assistant and the same doctor for about 40 years, or maybe more. He's also my primary care guy whom I very seldom see. But let me share this. He's the same one who prescribed the antibiotic Cipro for me about 3 years ago when I was having some odd throat symptoms. He said I had an infection. How he knew that, I don't know. And he sent me off with this antibiotic that ultimately caused my ear to ring and did not solve my throat symptoms. And no, he never mentioned that side effect. But if you look it up, that is clearly one of the prominent warnings about Cipro. Then he sent me off to see a specialist, an ENT, an ear, nose, and throat guy, who prescribed Nexium. You know, the little purple pill for acid reflux. Somehow my gut told me that I should do some more investigative work before beginning this treatment, and ultimately I solved my own problem with apple cider vinegar and some diet changes. But that's another story. By the way, my ear has not stopped ringing since that day, so my feelings toward the ability of this doctor primary are not so trusting. Nevertheless, he's known my mom and her unique and twisted health history, so I went along to be the advocate, another set of eyes and ears. Notice I did not say a mouth, because I very specifically make it a point not to speak during her appointments, unless, of course, I have to. Mom and I were directed into the exam room by the bustling doctor primary, who didn't even take a moment to say, "Hello, haven't seen you in years. You look good, blah, blah, blah." "Sit," he ordered. Then in a sharp tone, "What can I do for you today?" My gosh, how I hate that comment. What can I do for you? Is it just me, or does that smack of arrogance, of a one-sided "I'm important"? Well, she proceeded to tell him that she was feeling short of breath, coughing, and needed oxygen during the day now instead of just at night. He interrupted her, swiveled his chair in my direction, looked at me in the face, and demanded, "Why is she on oxygen?" Wow, I felt like I was back in school. Was this a trick question? She's been on oxygen for the past 6 years at night. "You're not answering my question," he snapped. "Why is she on oxygen?" Well, because her oxygen saturation levels are low while sleeping, and we had it tested and oxygen was prescribed. "I understand how that works," he insisted, "but why is she on oxygen?" Seriously? I looked at my mom for some help here. He began to grow in posture, turned red, and yelled at me, "You're not answering my question. Has anyone mentioned COPD to you?" No. "Well, then why is she on oxygen?" he demanded, as he just about lunged at me from his seat. I physically backed up in my chair, sensing that he was going to grab me, and put out my hands and said, "Whoa." Every instinct in my body told me to get up, gather my mom, and get the heck out of there. But then what? Where would we go? Who would we see? So I dropped my eyes, no longer made eye contact with him, and plastered my face with my best look of irritation. He did his cursory blood pressure exam, mumbled a few words, and sent Mom off to the blood lab and downstairs for a chest x-ray. All the while, I was livid, asking her, what the heck was that all about? What just happened? Mom tried to make nice and suggested that he felt threatened. What? I very specifically had not said a word, not one word, prior to his attacking me. We got the blood work done, as well as the x-ray, and went back upstairs to his office. He ushered us in and said, blah, 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 "Let me refer you to a specialist." No kidding. And then he said this. He said, "Let's continue this conversation at the front desk." Thinking that we were going to move to another venue to talk a little bit further, he handed us off to the assistant who made the appointment with the specialist, and we never saw him again. He did not explain the results of the chest x-ray, or really why he was referring us to the specialist. He did not ask if we had any questions. He did not say goodbye. Now, I spend my days talking about the patient experience, trying to educate and inform patients and healthcare workers. And I say, wow, if this is what's really going on in the real world, then I need to do more than talk. This man needs to be throttled. Actually, he needs to be reported. He needs to retire. The assistant handed us a piece of paper, a summary of the appointment, and I just have to shake my head. On the report, it stated that in addition to talking about Mom's symptoms, they discussed how to manage her diabetes. Hello, my mom doesn't have diabetes, and never, ever was the word diabetes even uttered during that appointment. Well, guess what? Now he can bill for a diabetes discussion. Plain and simple. That's what that is all about. Well, I hashed this entire encounter around in my mind all night, and when I got up the next morning, I told Bob, I'm going to call this character today and discuss the way he treated me. He simply cannot get away with that kind of aggressive behavior. What if he acts like that to others? As if psychic, the phone rang. It was Dr. Primary, looking for my mom to share the blood test results with her. Ha ha! He got me instead. He hurriedly bustled through the results, assuming I wouldn't know what he was saying, but instead I asked specific questions about certain results that clearly annoyed him. As he tried to get off the phone, I said, I'm happy you called because I have a question. Why did you attack me yesterday? His response, I thought you felt that way. Why did you feel that I attacked you? Because you did? Well, I'm sorry you felt that way, he said quite flatly. Well, it was out of line, I told him, and quite uncalled for. His reply, I'm glad we had this conversation. My reply, oh, and by the way, my mom doesn't have diabetes like your office visit summary suggests. And he said, that's because we're managing it. Oh, my heavens. And he's supposed to be the quarterback. He doesn't even know that for the past 6 years my mom's been on oxygen, doesn't know that she doesn't have diabetes. What a waste of time. My fear here is that there are more of these Dr. Primary types out there terrorizing patients who may become so intimidated that they question nothing, and in doing so become sicker than they need to be. If my experience is indicative of what's going on out there, then we are in real trouble. Then the patient experience conversations are merely that, conversations, never put into action. Quite frankly, we shouldn't even have to talk about, have seminars, trainings, symposiums, conferences on the patient experience. How about if doctors, who after all are just people who put their pants on one leg at a time, just like the rest of us schleps, what if people just treated people with basic human kindness? Say hello in a sincere manner. Ask honest questions. Seek honest answers. Smile, pause, breathe. Don't take yourself so seriously. Touch, smile, say goodbye. It's really so simple. So when I say I was attacked by a primary care physician, that he was after me, that's what happened. But instead of my running away from him because he scared me, I'm running away because no one should be treated like that by another human being, let alone your doctor of 40 years. I'm choosing to run and will never go back to see him. He is no longer my doctor. He doesn't deserve to have me as a patient. Do you have a scary doctor? Run. Don't walk, and find someone who will treat you like you deserve to be treated, with respect and dignity. The title of this radio program is called Speak Up and Stay Alive for a reason. Speak up, and don't let anyone call you their patient who doesn't deserve it. Sometimes you have to speak up and stay alive. Help! Run! He's after me! Now, let's hear some legal news you can use. Okay, you are living dangerously if you don't have an up-to-date healthcare power of attorney, a living will, or a financial power of attorney. If you want to control what happens to you, your health, your end-of-life wishes, and your money, get this done this week. And who better to help you with this than my friends at Schraff & King? This is what they do, and they even have a certified elder law attorney on staff, one of only a handful within the state of Ohio. So don't play roulette with your future. Call Schraff & King today and let them know that you heard about them on Speak Up and Stay Alive. Their phone number is 440-585-1600. That's 440-585-1600. Come on, make me proud. Call them this week to review your current documents or to update or create new ones. 440-585-1600 or visit them at schraffking.com. Where do you go to buy your cars or trucks? I buy mine at Junction Auto Family. People you can trust for your next new or used car. Located on US 322 and Ohio 44 since 1931. Visit junctionautofamily.com.
Are you overwhelmed by healthcare options? Does your primary care physician tell you one thing and your specialist another? Do you hear about the latest and greatest vitamins on TV and wonder if they'll work for you? Come to a place that's designed to take the stress out of staying healthy. At the Nutrition Shop, we have a variety of practitioners and specialists available to answer your questions easily and clearly. Visit us online at thenutritionshop.net and call us toll-free at 866-461-4536 or stop into any of the offices near you.
After the show, be sure to visit the website, speakupandstayalive.com, for more life-saving information. Plus, that's where you can purchase the book, Speak Up and Stay Alive, The Patient Advocate Hospital Survival Guide. Bring the book to the hospital with you. It's the best way to stand out, and in a positive way. And remember, we donate 2 handmade pillowcases to either a troop member in Afghanistan or to a local veterans shelter for every book sold, with your name on it as the donor. So for a mere $20, you benefit, and so does some well-deserving warrior. Give a meaningful and useful gift that really says, I care. Give the gift of healthcare safety. Purchase the book, the patient safety logs, and throw in some of those icebreaker cards. It's a one-size-fits-all present that everybody needs. You can order online at speakupandstayalive.com, or you can request by email at speakupandstayalive.com, or call me 440-725-5462. And now, back to the show. You are listening to Speak Up and Stay Alive, Patient Safety Radio, and I am your hostess, Pat Rulo, always on the lookout for the best of the best when it comes to our guests. And as a loyal listener to this program, you know that we often talk about how to stay safe as a patient and how the patient experience plays a role not only in our perceptions, but in the reality of our outcomes. And better outcomes are associated with a positive patient experience. And often, a positive experience has little to do with skilled surgeons and state-of-the-art equipment, but more to do with how we are treated, how people speak and react and listen to us. And that's why today's guest has a vital message to share. She is Dr. Helen Riess, the Chief Scientist and Chairman of Empathetics. Empathetics Incorporated is an empathy and communications training firm that provides continuing education, accredited web-based courses primarily to the healthcare sector. She is the Associate Clinical Professor of Psychiatry at Harvard Medical School and Director of the Empathy and Relational Science Program at Massachusetts General Hospital. Helen is a psychiatrist who developed an empathy training approach based on research that has been rigorously tested in pilot studies and randomized controlled trials, and has devoted her career to teaching and research in the art and science of the patient-doctor relationship. And this is a topic that both providers and patients must become involved with, so it is with my great pleasure to share an expert with you. Welcome to the show, Dr. Helen Riess.
Thank you, Pat. That was a lovely introduction. It's a pleasure to be here with you today.
Well, I'm so glad to have you here. Now, I want to start with what we just were talking about briefly. So is it true? Do patients who experience empathic care really have better medical outcomes?
Well, Pat, that was a question that my research team was very interested in, because many people were making that claim, and we, of course, believed it to be true. But we decided to do a systematic review of the literature and a meta-analysis of all randomized controlled trials that claimed that relationship factors improved heart health outcomes. And this turned out to be a 3-year project. But what we found in the end was that the most rigorous and well-done studies actually demonstrated that there were significant and very meaningful effects in relationship improvements, having direct heart health improvements in obesity, hypertension, diabetes, asthma, osteoarthritis pain, and pulmonary infections. And so this notion that a better, quote, bedside manner really helps people's health has actually been really shown to be true.
Mm-hmm. So you are finding then that the quality of care in medicine can actually be improved by integrating empathy into the medical education.
Absolutely. I mean, we know that patients are more forthcoming when they feel that a doctor or any health provider really cares about them. Having the care and the genuine interest from the care provider really leads to far more disclosure and more opportunities to really partner as two people invested in healthcare.
Mm-hmm. How do we answer this question then? Are nice doctors better doctors?
Nicer doctors have far better relationships with their patients, and it does lead to really working together to solve healthcare problems, and also learning how to truly motivate people based on what they really care about. Some patients don't care so much that they have a chronic illness, but they really care about being healthy enough to take care of their loved ones. And when the conversations can turn more to what it will take to be able to be doing the things that they want to do, that's a way to really positively engage people in their health care.
Mm-hmm. And I watched the video of your TEDx talk, The Power of Empathy, and you ended by stating that empathy is our biggest, smallest problem. So if we have better outcomes and nicer doctors are better doctors, why is this still a question or a problem?
Well, I think you're asking a really, really important question, Pat, and that has to do with the way the culture of medicine and healthcare has been evolving. Healthcare is in a really tremendous time of change. There's so many new requirements, regulations. We're having to learn the electronic health record, and so there are many more changes that are occupying people's time and pulling them really away. There's also a lot of new technology that people are trying to master and understand. It's been really challenging. Keep the focus on the relationship. But I think what many of us are hearing is that patients are just not satisfied with their care, and the rate of burnout is climbing to really just staggering levels. And so something needs to change to re-engage, doctors, nurses, and patients back into, strong relationships again.
And that's what your organization is all about. So you have training for providers. Tell us how that works.
So I developed empathy training based on my own experience of patients in my psychiatric practice spending so much time talking about their dissatisfaction with their medical visits, and then noticing that, there was really a public outcry for more empathic and compassionate care in major headlines and news stories. I was doing a neuroscience of empathy fellowship, and by understanding how our brains work, I developed training that was much more based on getting into sync with people. Feedback that we get on our empathy training, that people say, I feel like I like my job again. I feel like it's made me aware of how much time I spend at the computer, looking at things about my patient, but not really looking at my patient at all. Mm-hmm. So these are our attempts to change the orientation and to expand the field of vision to really include the patient. After all, that's really what patient safety is all about, is people.
Mm-hmm. And I would imagine that there's just so many positive outcomes to that. I mean, we already mentioned that would improve health outcomes, and we're talking about patient satisfaction scores. And I would also imagine that a huge number of malpractice claims are filed due to just communication failures, and that hopefully this would just be enough for some people to say, whoa, we need some serious empathy training here.
Yes, your point is absolutely right. And most people in the world understand that medicine is not an exact science, and they can accept that an error would happen. But when it's made in the context of any kind of arrogant, dismissive, or rushed kind of encounter, then they're not so forgiving, because they feel, as they should, that they deserve the full attention and mindfulness of the person taking care of them.
No, I absolutely agree. Just from my research and findings and talking with folks, that's exactly it. Something can go wrong and people can forgive that, but if it's not brought to their attention, or if it's not brought to their attention in a kind and compassionate way, you're exactly right. That's when the anger and the frustration bubbles to the top. It's like, all right, I'm going to do something about this. So, just a simple kind word could turn that whole situation around. What role does technology play in reducing the effectiveness of empathy?
Well, a lot is blamed on technology, as if the technology is actually getting up and putting itself between us and our patients. It's really how we're using the technology.
Right.
I've heard patients really complain bitterly that their doctor's backs are to them while they're typing away at their computers in a corner, and I understand fully how disturbing that is. And I heard other patients talk about how much they appreciate that the computer screen is turned toward them, and they're invited to look at their labs or their results together with their doctor or their nurse practitioner, and they're sort of brought into the conversation in a way that it feels very inclusive. I do feel that the strong move to ordering tests quickly and no longer touching patients by doing a thorough physical exam and really looking at the cues and clues that just come with knowing what to look like, on the skin, or noticing that somebody's flushed or whatever, like that. When we think about ordering tests to see the insides of people, but we forget to look at the most obvious external signs.
Yes. And I agree with that. I agree that technology has really improved healthcare, but I do think the provider needs to be mindful of how it's being used. I know several occasions I've been to the doctor, and by the end of the consultation, I know every freckle on the top of his head, and I could tell you that he doesn't know what color my eyes are. And so what you're saying is very true. I also think that there's so many hidden clues, maybe diagnostic clues as well, when you really look at somebody and listen to them and watch their face and their body movement and their body language, where you could probably pick up ideas and clues as to what might be wrong if you just spent those few minutes taking care to, be one with that person. So providers actually need to pay attention as to how they use that.
Absolutely.
Mm-hmm. Well, now, since we've determined that the doctor-patient relationship does have an impact one way or the other on health outcomes, and because many of our listeners are patients, they're not healthcare providers, let's discuss some ways that we, either as the patient or the family member or the advocate, can help to improve our relationships with our doctors. How can we help them along and help them to be more empathetic towards us?
So that's a great question, Pat, because I think we're at an interesting time in history, because traditionally, patients did not feel that comfortable speaking up to their doctors. And there is this real sense of, an authority difference and a power difference, and they don't want to upset their doctors. And so I do feel that patients need some coaching in how do you talk to a doctor who isn't really understanding your message, or is mishearing you, or is perhaps using medical language and jargon that you don't even understand. I hear so often patients come home and say, well, I didn't really understand, what she was saying, but I was afraid to ask. So right now I don't really know how many times a day I'm supposed to be doing or what. So I think some tips are to have some communication tips at your ready disposal. I mean, it's fine to say, I don't understand what you just said. There's no reason why patients should feel embarrassed or ashamed that they don't understand medical lingo. So there are ways to speak up for yourself to slow the process down a little bit.
And maybe also when you go to an appointment, to go prepared with questions and bring somebody with you, because you think you know what you're going to say and ask, and you get there and everything is rushed and hurried, or you're feeling nervous and scared, and all of a sudden you have no idea why you're there, what you're supposed to ask. So maybe to help guide the visit and to help the provider say, hey, here's my list of questions, and now the provider knows they're not going to leave the room until those questions are answered. And then if you bring someone with you, if you forget or feel uncomfortable to say something, hopefully that person can chime in if necessary. So I think there's a lot of ways that we as a patient can work in tandem with our provider, and I would imagine that the provider would appreciate that.
And also, sometimes, there might be 7 or 10 things on a list, and in these short visits today, that's not always possible to go through every single thing.
Right.
It might be important to say, there are 3 really important things I'm worried about, and there are 4 things that I'm concerned about. Do you want to try to go through all of them today, or should I schedule another visit for these other things? So it's a way to recognize that time is limited, but also that your concerns shouldn't get swept under the rug.
So that way the provider knows that here's this list and, we're either going to get to them or not, but they're not going to be forgotten. That's a good idea. Well, now, where can we learn more about you and your work, your programs, and the Empathetics training?
Well, we have a website that has, all the information about the company that people can access by themselves, and that's at empathetics.com. We provide e-learning opportunities, that people can access by themselves through the website, and also for large organizations. If a hospital or clinic is interested in more of a cultural transformation, it doesn't do to just train, 5% of the people. What really creates a cultural transfer to train a whole organization.
Right.
So there's multiple opportunities.
Even if a patient is hearing this, bring this up to your doctor or hospital and say, I heard this and this might be a great place to look into. So it's empathetics.com, right?
Right.
Well, I know there's so much more to this topic that we could delve into, but I think we touched on a couple highlights here, and hopefully enough to give people that impetus to head over to your website and take a look and to give empathy a thought, because it's not just in healthcare, it's in all aspects of our life that we need to work on being empathetic. I'd like to end, again, on your TEDx talk, you mentioned something as simple as the act of saying hi or hello, and you brought up the Zulu word for hello. Give us that briefly and tell us about that.
I was in Africa for 4 months of my own medical training, and I was just so struck that the word for hello in Zulu is sawubona, which means I see you.
Mm-hmm.
And to me, that is such a respectful way to greet somebody. Not just hi, how are you, but I see who you are as a person. It's like the biggest tribute. If you try that in your everyday life, like you look people in the eye in a way that says, I see you, It's amazing how much friendlier and open people are. So I want to just, end with your point that these skills are certainly not just for doctors and patients, but seeing everyone in our lives, our children, our spouses, or partners and coworkers. It just makes for life to be so much richer and more rewarding when we treat people humanely.
I agree. This is a beautiful way to end, and it's sawubona. Is that how it's pronounced?
Yes.
Sawubona. I read also that there was a response that was sikona, which means I am here. So it's hi, hello, I see you, and then the other person responds to say I am here.
That's right.
Oh my gosh, how beautiful that is. So that until you see me, I don't exist. But then when you see me, that brings that other person into existence. And I love that. I might start greeting people sawubona. How's that?
Well, I think they'll read it in your eyes, whether you use that word or not.
All right.
It's a lovely way to complete our conversation, Pat. Thank you.
Thank you so much. It was a pleasure to have you here.
Same here.
I'm Jerry the Germ with a Speak Up and Stay Alive healthcare and hospital safety snippet just for you. Here's our expert, Pat Rulo.
Hey Jerry, here's a quick one. Use enough liquid hand sanitizer to keep your hands wet for 15 seconds. That's how long it takes to get rid of Jerrys like you. For more tips like this, listen to Speak Up and Stay Alive every Saturday morning or visit speakupandstayalive.com.
Listen to Speak Up and Stay Alive RadiOh. Tune in every Saturday morning. For more information, go to speakupandstayalive.com.
Tired of the same old presentations?
Can you forward to slide 38, please?
Are you looking for a new, out-of-the-box topic for your next event? Want your group to leave inspired, informed, and satisfied? No PowerPoint presentations and dim lights here. No snoring or snoozing goes on during Pat's presentations. To help your entire group, organization, business, or church stay safe during any healthcare or hospital experience, invite Pat to speak. Pick a topic from her website or request your own. Visit her website, speakupandstayalive.com, or call Pat to discuss how she can make your next event fun, enlightening, and life-saving. Want testimonials? Go to the bulletin board link at the website for color pictures and comments from real people. Again, it's speakupandstayalive.com or call 440-725-5462. That's 440-725-5462.
It's summer, and that can only mean one thing. It's time to have some fun with your friends, your family, and there's only one place to do that: Pioneer Waterland and Dry Fun Park, 10661 Kyle Road in Chardon, Ohio, 440-285-0910, or visit the website pioneerwaterland.com. See you there. Speak Up and Stay Alive. 5 simple words that address a complex problem, and that is your safety when it comes to every healthcare or hospital encounter, or the safety of your family and friends. These words need to be in your mind and on your lips. And to help with that, I wrote the book Speak Up and Stay Alive, the Hospital Survival Guide, on the recommended reading list of the U.S. Army's Medical Department Office of Quality Management. And it should be on your reading list too. Get a copy for yourself. Give some away as important gifts. Bring the book to the hospital with you. Lay it on the tray table. Now, without saying a word, everyone knows that you are an e-patient, equipped, and eager to get out unharmed. You can purchase online for only $19.95 at the website speakupandstayalive.com, or call me and order by phone 440-725-5462. That's speakupandstayalive.com or 440-725-5462. Speak Up and Stay Alive. The book tells you how, and I hope you do. As promised, I'm going to play a short interview I had with a 20-year-old who was happy to share his thoughts on a high school shooting. We did this for my internet radio station, Those Radio Kids. It's a community station specifically for Geauga County, Ohio, that features only youth talent and conversations. And you can find that at thoseradiokids.com. I was simply thrilled when I met him and encouraged that there are young people out there with the ability to genuinely empathize with others. So I think you'll enjoy this. Take a listen. This is Pat Rulo, founder of Those Radio Kids and host of Speak Up and Stay Alive, Patient Safety Radio, always on the lookout for young people who have a talent or have something to say. And my, did I find a special treat last week while visiting the Party Loft here in Chardon. An engaging young man, an employee, approached me and we somehow wandered into a conversation about the Chardon school shootings and his perspective on healing and learning, and that enticed me to share his thoughts about that with you. He is Drew Gittens, and let me tell you a bit about him. Drew is a graduate of Chardon High School, now a student at Capital University, and is a man of many talents. He was a high school letterman in football and baseball. He was part of a club where students got together to find ways to make their school a better place. Drew was also a member of Student Council, National Honor Society, a part of the Cathedral Council at his church, and a member of the Team Leadership Corps, as well as a martial arts student, a guitarist, a pianist. In addition, a select group of students voted Drew to win the Renaissance Award. This award goes to a student who displays a wide variety of categories of excellence, someone who distinguishes themselves through leadership, citizenship, sportsmanship, appreciation of the arts, and overall respect for the people around him. This award also goes to a student who illustrates well-rounded achievement, hard work, and determination. And I must say that I am quite humbled to be sitting across from him today at the Party Loft. So welcome to the show, Drew.
Thank you very much for that wonderful introduction. It means a lot to me. I didn't know you knew that much about me. That's awesome. It's I had a really wonderful high school experience, and I wish everyone had the chances I had.
Well, you obviously took advantage of them as well, and the internet is a great place to sneak around and find out information about people. Anyway, when you and I met, we talked about making a positive change in the face of negativity and tragedy, and how getting involved and how something good can come out of something bad. So let's go back to that morning of the shooting, February 27th, 2012. You were a sophomore at Chardon High School. Take us back to that day, and please share your experience with us.
Yeah, I was down the hall to the left, down in Mrs. Weaver's room. It was my English class, my first period, and we really, for a long period of time, had no idea what was going on. Partially because we have such bad cell phone service, and then when we did get cell phone service, we were on Twitter and we heard, well, there's multiple gunmen, there's this, there's that, there's all these rumors, and we had kids come in from the cafeteria who had run in from the cafeteria and were talking about maybe somebody had been pulling a prank or there were firecrackers going off, and it was really just mass confusion. And once we kind of got an idea of what was actually happening, and it just kind of hit us, and a lot of kids just really didn't know how to react, and I think I was one of them. We all just kind of stared at each other, kind of quiet and nervous. I mean, sometimes even nervous laughter, like that kind of thing. Like, is this really happening? That kind of situation. Yeah, for me, it was just really, really, really a surreal experience. I've never experienced anything like that before, and because you're always wondering, is something going to come through the door? Am I going to have to make a decision at that point? Is whether or not I'm going to go hide? Am I going to try to stop what's going on? Like, what is my course of action once that all happens? And the whole day, the rest of the day kind of goes by in a blur. You know, the helicopters and the people coming in through the doors with huge weapons and escorting us out. And then I personally have never seen my parents cry the way they cried when they saw me. So just a really surreal experience. It's a really crazy day, and one that I'll obviously remember for the rest of my life.
Wow, yeah, those are kind of things that we've never had to deal with before, so how do you even react? Yeah, so what made you feel the need to move forward with positivity instead of negativity?
I think one of the things for me is that I was in the school, I was part of an event that lots of people can't really understand, and that being said, I was not, by any stretch of imagination, the most affected of my classmates. I mean, I was not in the cafeteria. I did not see those events go down. I was not personally, like, very close friends with any of those that are seriously affected or the families. And for me, I use that as a way for, I think I can be positive because I was not so directly affected. Does that make sense? It shocked me to my core. It was an event that was very, very negative, and I felt like because of my position, I could be a positive influence and really help those that were truly devastated, that were truly torn apart by these events. And for me, it was a need to move forward. It was a need to, well, what can we do about this? What can we accomplish? How can we move forward?
And so with that, how do you move forward and find a new normal?
It's a process. It really is. We had the morning process that was, and all the credit in the world goes to the high school and for allowing us to mourn, and then setting up programs for us to, I guess, come back to school and try to be comfortable, and the wonderful outpouring of support from different schools and areas, and that really truly meant the world to us. And then from there, it's about trying to figure out how you can make a positive experience out of what you had, and how you can help other people that have gone through violence or gone through really traumatic experiences. And that's the thing, is now we are part of this club, dare I say, of people that have gone through and experienced these really violent actions, and we understand it on a level that only a handful of high schools can. And that being said, we can now help each other out. We can, I mean, obviously we've been contacted by Virginia Tech, and who had their issues, and one of the most powerful images in my mind of going back to school is the huge Columbine poster, all the faculty and students had all signed, and it was hanging up on our wall. And it just, I mean, that's the kind of images that we got, that we are part of this group, and then we can help those in the future that have to deal with this, and we are helped and backed by those in the past that have dealt with this. And just a real sensation of that we are not alone, and then the support that came for us, that's what I think got us through.
So it seems like help from outside sources. I would imagine counseling, I would imagine strong family ties, and then I would also think that the community coming together. How did the community come together, and did that help, and how did that affect and create a positive outcome?
Well, it starts with the vigil. That first night we had the vigil at the square, and just a huge amount of people at that. And when we did go back to school, the members of the community lined up along the roads where we did the walk-in. For those of you who don't know, we walked from the square back to the school. It was kind of like symbolizing us taking back our school, and the members of the community stood along the road and clapped for us while we went in. Stuff like that, and it just happened more and more. You have the tree quilt that those ladies, I remember those ladies sitting out in front of the tree for days making that, and the signs, and just really everything, and the community did really come together for us in that time, and it really meant the world to us.
Tell us, now you're at Capital University and you're playing baseball. What are you studying there?
Right now it is pre-medical psychology, which means I am doing the pre-med track, but I'm also going to try to at least do a major in psychology and one day be a psychiatrist. So eventually I'd really like to get into the counseling for people that have gone through serious trauma and that kind of thing. Obviously, my past has an effect on what I want to do in my future. And that for me is a amazing way to give back and also support my family. And that's something that's very, very important to me, is that one day I'd like to have a family and I'd like to be able to support them. And I think that ties both of those together.
So that whole experience actually has colored your future. You may not have gone into this, probably never would have thought to go into this type of a field prior to this. So this is a way for you to take that negative experience and spin it around and do some good for others. Yeah, so do you have any words of advice for someone going through a difficult time? And it surely doesn't have to be as traumatic as a school shooting, because grief and anger and fear affects every one of us. So maybe share a little bit of that with us.
Yeah, the first bit of advice that I have is really just to talk about it. Find, if it's not a counselor, if it's not a professional, then find somebody you're really truly comfortable talking to about, and really try to get these emotions out and get these feelings out, and realize that it's okay to question why these things happen, because I know I did, and that's the healthy response. And you have to come to terms, I think, with what is happening to you and what has happened to you, and really try to put a positive spin on it, or really try to use your experience to make someone else's life better. One of my favorite sayings is just be the answer to somebody's prayers. And that goes for both sides of the story, whether you are personally going through the traumatic experience and using your experience to help someone else who's going through a hard time, or if you're not going through that traumatic experience, but you know somebody who is, and be the answer to their prayers, because in all probability that person feels very alone, and that person feels like no one else knows how or what they're thinking. And while that's true, that doesn't mean you can't help the situation.
Wow, that's beautiful. And you're a beautiful, beautiful person. I'm so honored and pleased to have met you. Drew, what a pleasure. Do you have anything else that we didn't talk about today that you want to mention?
Just so grateful for the opportunity that you gave me. I'm very excited always to talk about my experiences, and hopefully some of your listeners hear this and realize that they're not alone, and that there are people out there that care about them. And I mean, for me, it's been my family, and I owe everything to them. So thank you so much.
Well, and thank you. You are an inspiration to the world, and I'm going to keep an eye on you. Thanks so much. Wow, what a young man. Don't you just love his favorite quote? Be the answer to someone's prayers. If we and our doctors and nurses could just keep these 6 little words in our heads, think of how much better everything would be. Be the answer to someone's prayers. And if you combine that with what our guest, Dr. Helen Riess, and I ended our conversation with, which was the Zulu word for hello, sawubona, which translates to mean I see you. Can you imagine my mom's harsh primary care physician if he entered the exam room with a sincere sawubona? Or if before he grabbed the door handle, he thought to himself, be the answer to someone's prayers. Wow, I think we hit upon something here today, don't you? We need more sawubona, folks. So let's you and me make a pact that going forward, we will think and feel sawubona every time we meet or converse with someone. The cashier at the grocery store, the bank teller, the gal at the post office. Let's not lead with, hi, how are you? Yeah, I'm fine. Let's really see that other person. I see you. Sawubona. And let's ask ourselves each and every time we communicate with someone else, how can I be the answer to someone's prayers? I'm betting we'll feel better too. So with that, I leave you, but I'll see you again next week. Same time, same place, but never the same information. Until then, I hope you have a healthy and a happy week filled with sawubona moments. I am Pat Rulo, and I am your guide to safe and successful healthcare and hospital encounters.
Listen to Pat Rulo and Speak Up and Stay Alive RadiOh. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com. Hello? My name is Joe. Is this Pat Rulo, the host of Speak Up and Stay Alive RadiOh?
Why, yes, it is.
Who are you?
Who am I? I am you. I am every person who has ever been in a hospital or doctor's office and has received less than acceptable treatment.
Who are you?
I am you. The person who got an infection during a simple outpatient procedure.
Wait, who are you?
I am you, the patient whose questions are ignored, who struggles to speak to the doctor as he or she has one foot out the door. I am the missed heart attack, the hospital-acquired infection, the wrong diagnosis, the unanswered call button.
Oh, so you're all about me. Do you have a quick tip to help me stay safe?
Take care of yourself by paying attention to infection opportunities. Where are they lurking? Waiting room magazines, TV remotes, elevator buttons, doorknobs, restrooms. The opportunity to acquire an infection in the hospital is huge. Germs and bacteria are everywhere. They float in the air, live on your clothes and hands, and reside on everything in sight. The consequences of a hospital-acquired infection are grave. Yet, prevention is simple. Be a germaphobe. Be a clean freak. And Joe, wash your hands often and remind others to wash theirs before touching you.
Listen to Pat Rulo and Speak Up and Stay Alive RadiOh every Saturday morning from 9 to 10 a.m. on WHKW AM 1220. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.